Today we'll learn about autoimmune disorders. In mainly pertaining to the nervous system I'll be talking about, but let us know what are autoimmune disorders. So these are like rare only, but of late we are hearing about this more often, and parents also are having many doubts about it. So let us see what it is. Autoimmune. Let us split the word and see. Auto means self, like auto start, like that we hear, right? In that way. Self and then immune. Immune means related to the immunity. Generally, immune system is that system which will protect us from the invading microorganisms and the external harmful substances. So let us know what is immune system first. Immune system is nothing but the system which will protect us from outer invaders, that is microorganisms mainly. Immune system is nothing but the system that protects us from the infections. So the outside invading microorganisms. It will protect our body from outside invaders. So that is how it is. So generally what will happen when a microorganism attacks, the immune system will sense it and then attack it, kill it, and then stop its own process of the immunity as well. That means it needs to have a break mechanism also at the end. Autoimmunity means the immune system is attacking its own self. That is what is the meaning of autoimmunity. So generally, as I told you, there should be a start point, finish point, and then the break point also should be there. Suppose let's say there is a defect in the system where it is detecting the own antigen or own body as a foreign thing and then attacking it, and that too without a break mechanism. That is when the autoimmune disorders trigger. So that is about the autoimmune disorders. So where all do they affect? They can affect the whole body, and any system can be affected with that. And in particular, regarding the nervous system, it can attack the brain, it can attack the nerves which are supplying the various parts of the body, and then it can attack the muscles also. So at all levels, the problem can be there. What is the cause? Why does this occur? Usually the infections are the triggers. So the body got triggered with because of some other infection, and then the brake mechanism has failed, or the body is getting confused from the bodily proteins with the microorganisms. In that case also, this immune attack will keep on continuing, because of which the symptoms, the other problems will arise. Suppose let's say the brain is getting attacked. There are 3-4 disorders wherein the autoimmunity can occur. Now let us discuss about the autoimmune disorders of the brain. In brain, the commonmost that we see is encephalitis. Encephalitis means nothing but there is some problem with the brain function. So because of which the child will be more agitated, more sleepy than usual, more irritated. Generally, the parents will notice that the behavior has changed over the time, either to an aggressive side or to a docile side, either ways. And then the child can start having some abnormal movements also, like tics or something like that. So these all can be there. So then we'll have to think, after we have ruled out the infection as potential causes, one of the group that we also have to think is the autoimmune group, because the treatment part will be totally different when compared to the other treatments. So encephalitis is very common. We'll call it as autoimmune encephalitis. And there can be some group wherein exclusively the child can have abnormal movements. As I told you, tics can occur, or some funny sounds they can make. So the child can acquire a specific posture or something like that. So that can also be there. So the brain gets affected, and some kids can also have seizures as presentation. These all will come under autoimmune encephalitis. So under the autoimmune encephalitis category, again the causes might be little more different. So that is about the brain autoimmune encephalitis. Sometimes the child will have some infection. A week later, child will present with excessive sleepiness, and then can have couple of seizures. And then when we do MRI brain, they have specific changes where we label them as demyelinating diseases. They are also part of autoimmune phenomena only. So this is about the main brain per se part. Then coming to the nerves. Nerves also can get affected in the so-called autoimmune fashion, and they can have certain weaknesses, or they can have limping, which can be gradually progressing or little acute in onset as well. So they are called as demyelinating polyneuropathies. So, and in some cases, the muscles also can get affected. The muscles will become sore, painful, the child can't walk, and muscles also can be affected in this manner. First of all, can it occur at any age? Yes, it can occur at any age. So generally more common in adults. In children also it can get, even an infant also can get such disorders. When to suspect such a disorder? When do we have a doubt that such and such disorder can be there in my child? So generally the most common cause of any brain related thing is the infection part. So if the child's presentation is not fitting into infection, or the child is not responding to the usual infection medication or the routine care that we give, and then child also will be giving little more clues, like in, as I told you, in MRI brain or in blood tests, so on and so forth, then we have to suspect this disorder. Okay, then how do we diagnose? Let's say we have suspected that such and such disorder can exist. Then we have a few blood tests that can be done, and then we have other testings that can be done, such as MRI brain, and then testing the spinal fluid, and then sending a few advanced tests in the spinal fluid or in the blood to confirm that there is some autoimmunity going on. Then how do we treat it? Generally the treatment, as I told you, there is some problem with the immunity itself. So we have to stop that excess immunity at some point. We have to give that break mechanism. So for this, a broad spectrum wherein it will control all the immunity is steroid. Steroids are the main cornerstone of treatment for most of the autoimmune disorders. But they will also have their own effects, wherein there is a lot of advance in this field over the past 10 years, wherein we are targeting specific mechanisms of infection and just targeting that alone, so that other mechanisms also will not get affected and our immunity also will stay intact for the other. So suppressing the whole of the body immunity is not a good thing, right? So specifically we have to act wherein the child is having the problem. So such medications are also available now. So the scope of treatment has changed a lot, with less side effects and more effectiveness. For any further queries, please comment in the comment section. Thank you.